Today we have Dr. Dilip and he's practicing in Agra, Uttar Pradesh. We also have the presence of Dr. Gajanan Bhat and he's practicing in Karnataka. Well, today, very welcome.
Thank you.
So we're going to be talking about kidney stone management as it's a very prominent and very important topic these days. The very first question would be for Dr. Dilip. Why do you think the number of cases of kidney stones are on high rise these days?
See, nowadays people are getting busier day by day. Lifestyle is getting from better to worse. So much pollution is there. People are not drinking. Kidneys are the organ which produce urine. As much as water we drink, it will produce more urine. So the function of kidneys is to dissolve all the bad things which the body wants to secrete out in water, and through the urine it comes out. So once your water intake is less, you're working all day, you're forgetting to drink water. Water intake less means urine amount is less. Urine amount is less means more crystals form. That leads to more stone formation. And nowadays people are having so much of junk food and everything. So all these things are leading to more of salt intake, more of calcium intake. That will lead to more stone formation.
Dr. Bhat, would you like to add anything to this?
No, he has completed everything. The most important thing is, as soon as you get the biggest problem in India is doctor shopping and ultimately going in for what is called as Indian system of medicine. I don't say that you should not go to Indian system of medicine like Ayurveda. Yes, there are treasures. You just unearth it, well and good. But the thing is that go for scientific thing and at least think about your kidney.
Yes.
That's very important. You keep on going from one treatment to other treatment, and ultimately what happens is kidneys will be damaged because of this. This liking for Indian system is excellent, no doubt about it. But the thing is that don't blame the other system. That's
Right.
what I want to say.
Dr. Bhat, I would also ask you the next question, which is what makes it very important for the patient to make this problem diagnosed at an early stage and not delay the process?
Yeah. See, good thing about stones is the moment the person suffers from stone, there is some amount of pain. The pain brings the patient to the doctor. There are stones which are very silent, but majority of the cases have pain. And the moment you find pain, go to an appropriate doctor. That's what is the important step one has to take when he has to get rid of the stone.
Right, right. Anything would you like to add to
Yeah,
this?
I would agree with him very much, because I have seen patients, what happens, they have had a pain episode say 1 year back, and then suddenly somehow they have taken some medication, then they'll forget about it, they'll keep doing their own work and everything, and they will keep having some small amount of pain, they'll keep taking medication, they will forget about it. And after a certain period of time, when they come to you or come to us, the stone would have already blocked the outflow of urine, and it would have dilated the kidney, and it would have destroyed the kidney. And at that time they want us to remove the stone, whereas in such a situation it's very difficult. The kidney is gone, there is no function with the kidney, and ultimately sometimes you have to remove the kidney also for the stone disease. So I would just like to add an word of caution for the patients here, that if you have any symptom of stone disease, or just incidentally you happen to do an ultrasound and find out there is a stone, you should visit us. You should not just rely on Indian homeopathy system, as Dr. Gajanan has just stressed, and you should seek proper treatment, not just take Ayurvedic medication and think that the stone will dissolve and pass away. It doesn't happen. You should consult us.
Right. Well, Dr. Bhat, I would like you to recall one of your cases which were most challenging, and how did you tackle that? How did you remove the patient's stone?
Yeah. See, as a surgeon,
Yeah.
the question is, we always think about surgery. That's the most difficult thing. And nowadays what has happened is keyhole surgeries have come into effect, and it has been very successful. The most difficult case what I did, I still feel that that was whether I should have done it, I should not have done it. See, only the time will answer. Majority of the case, because you have done the surgery, the patient will come to you, patient will walk home comfortably. That's a different issue. But the thing is that post-surgery, what are the effects? Because we are going to puncture the kidney. Recently I did one such case. What happened is, I could not reach the stone at all. It appeared the stone is visible, stone is in front of me, I could not reach it at all. The scientific principle says you have to go through what is called as a region called calyx. I could not reach. So I had to breach that scientific principle, go and hit it at a place where I should not have hit it, but I could get rid of the stone. Now the question is, I have got the stone out.
Oh.
Now what will happen to that, the part of the kidney, which has been treated is the question only time can answer. Right?
But generally, I also had some similar episodes, but
Yeah.
generally, God is always there, and body
Yeah.
takes care of itself, and generally they come out, except for a few cases. I would also like to narrate one of my cases.
Yes, sir.
So I am practicing in Agra, and this patient, one of my patients, he was an army man. He was working in Assam, and I don't know how he saw one of my videos on YouTube or someplace, and he had a 45 millimeter stone. That's a very big stone in the kidney, 4.5 centimeter stone. So he searched everywhere. He went to his military hospital. He went to some other hospitals. They said we cannot do it in one sitting. We'll make a big incision and remove it. Some doctor told me we'll need 3 sittings. Still, it will not be removed. Everything will not be removed. Then somewhere he searched about my name, and he came from all the way from Assam to Agra. And then I assured him that I will be able to do the case easily. And for such a big stone, it took me around 1.5 hours, and I could remove the stone from one single small size incision of 8 mm, and I could remove all the stone, and he was completely stone free, and he was so happy. He thanked me 100 times, and he said,
I already got the
"Doctor,
goosebumps."
yeah.
Wonderful, wonderful.
Yeah.
Well, in your experience, what precaution can effectively be taken by the patient in order to avoid these stones? And of course, we have the case of recurrent stones.
Yeah.
So, how to go about it?
The most important thing in stone disease is we know only what I should say is tip of the iceberg as of now. So if I say this has to be done, this has to be taken with a pinch of salt. That's what is the reason. So the most important thing is drink water, drink water, drink water, drink water. So
Yes.
that is the only evidence-based medicine. And then there is one thing else is alkalization of urine. Right? Urine is usually what happens is you have to make it basal, in the sense it should not be acidic. The moment that is made, only these two are evidence based. Rest of the things, you say you take this, you take that, you don't eat this, you don't eat that. These are all just, hearsay, I should say, because the evidence is not good enough.
Right.
So that is why drink water, and drink water is the treatment.
Is the key actually.
Yeah.
I would like to add a little
Yes,
bit
sir.
on this, because as Dr. Bhat told that you can have like alkalizers, sometimes there are stones which are infection stones. So you just should not you go on some video or something you read. You should visit the doctor, because there are different varieties of stones, and we only know what treatment is specific for your kind of stone. So just don't see on YouTube or see a search on Google and just try to treat yourself. Just visit us, take our advice. We are the experts in the field, and we can definitely treat it better than Google.
Well, what do you both think that is going to be the next breakthrough when it comes to the kidney stone domain?
See, we are also waiting for the breakthrough, and if at all it comes, I wish that we find out exactly what is the reason of stone formation.
Yes.
Yes.
That's what is needed. The moment you know it, I am sure that we are going to have no stones in the kidney. At that moment of time, I and my dear friend both will be joggers.
No, I would like to add a little bit on this. The breakthrough which are happening nowadays is because previously we used to have huge, big incisions for removing kidney stones. Patient used to stay in the hospital for 7 days, 10 days, like that. Nowadays, the surgery has progressed to, as I told one of my cases, in 1 centimeter, less than 1 centimeter incision, I can remove the whole stone. So in those cases, I can send the patient home in 1 day. Nowadays, the surgery has advanced to such limits that we've got flexible ureteroscopes. So we go through the natural urinary tract, from where we pass in, go inside the bladder, and then we go inside the kidney, and there itself with lasers and everything, we can fragment the stone to small dust, so there is no hole now. And this treatment, which is called RIRS, or flexible ureteroscopy, is going to the cornerstone of stone management in the coming years, and it will progress to such heights that I think for any stones, it will be the treatment of choice in the coming years.
Right.
And as Dr. Bhat told already, that if we are able to go into this breakthrough of how these stones form, we know certainly, but the thing is that the general public is not aware about the scenarios. So once the general public also has awareness and they know what diet to avoid and what things to do, then probably we could find a solution to this very much increasing problem in the society.
Well, any take-home message for our viewers?
Drink water. Drink water. Drink water and approach the appropriate practitioner. That's
Anything
what.
from you?
Yes, I would say the same as my friend suggested. Drink as much water as possible to produce at least 1.5 to 2 liters of urine per day. You can increase the intake of water in summer time and decrease it in the winter time. And just consult a doctor, any doctor, to seek proper treatment.
Thank you so much, sir, for your valuable insights. Thank you.